Dr. Melissa Black from Empower Family Medicine. In this video series, we're talking about medical documentation. This is primarily for my medical students, but it's also helpful information for patients to understand how medical information is charted so they know where to look for things in their own medical notes. We're going to talk about SOAP notes. Last time we talked about history and physical. So when I meet a patient for the first time, I want a very complete picture of what's going on with them. I write out a complete history and physical. If our patient from the last visit's returning this week, maybe they're coming back to have their blood pressure checked again. I already know their past medical history and their social history. I don't have to necessarily rechart all that. I'm going to write an abbreviated SOAP note. So this is a short format chart note for any kind of medical problem. What does SOAP stand for? S stands for subjective, O for objective, A for assessment, and P for plan, SOAP. So subjective starts with whatever the patient tells you. So maybe they're coming back in for a pain complaint. You might use OPQRST again. Tell me about your pain. What is the quality this week? Is the severity any less? Is the frequency any less than before? So you want to record what the person tells you. Maybe they have a new complaint and you're going to describe that. Anything that the patient tells you is subjective information. O, objective, are things that you observe. So the objective part of your note is your vital signs and your physical exam, anything that you measure and observe. Usually after my objective, I'll list any pertinent labs, either lab results that have come back since the last visit or things that we've measured in the office, like a urinalysis or an EKG finding. And then assessment and plan is just the same as it was from our history and physical. We think of PEST, so our assessment is what is the problem, the cause, and the status, and then the plan part is our treatment or our therapy recommended. I find when people are first starting charting, it's easy to get confused subjective and objective information. So when I'm hearing presentations from students, they'll tell me in their subjective part that Mrs. White came in for a rash that has been ongoing for a week, consisting of red macules. Well, red macules are probably not how Mrs. White described her rash. She probably said, I have spots, or something like that. If you're observing a red macular rash, that part's going to go in your objective section. So that's your physical exam. So again, when people are just starting to present an organized medical information in their thinking, they tend to get the subjective part and the objective part confused. So when you're doing your presentations, for my students, and you're presenting in a SOAP note format, go ahead and present the subjective information first. What has the patient reported? And then move to the objective part and report separately your physical exam findings. And that's really all there is to it, and that's a SOAP note. For patients, you should know that every time you see a healthcare provider, they will generate a chart note, either a history and physical, usually when they first meet you, or maybe for an annual wellness visit or annual physical, they'll update it. Or if you're coming in for sick visits, they're going to generate a SOAP note every time. So that's the bulk of your medical record, or your history and physicals and your SOAP notes.